Hello, I'm Belinda Bardsley. I'm an MS nurse at Austin Health in Heidelberg, Australia, and I'm also the previous president of MS Nurses of Australasia organisation, which is a professional network for people working in the field of MS, largely for nurses and healthcare professionals, and it's also there to really try and improve outcomes for people with MS. It was such a privilege to be invited to speak to ECTRIMS this year about some really important research that's been conducted for the first time in Australia, and it was something that was very dear to my heart, having worked in the field of MS nursing for about 15 years now. What we wanted to gather was some information for the first time which was seeking to find the value of MS nurses from a patient's perspective. So we wanted to understand how people with MS viewed MS nurses, what sort of benefit they thought we may provide, and also to try and gather information about whether it made any difference in terms of their health outcomes. And also, importantly too, did we make some sort of contribution to economic differences? So the reason this was important was that I felt for a long time that MS nurses seem to be a really important conduit on the phone or in clinic. It seemed to me that we made a difference in terms of keeping patients on medication and keeping them well, helping them manage, troublesome side effects, helping answer important queries, making sure that they really understood what a relapse was and what to do about it, helping to field problems and speed up, appointments, advising them when it was important to present to emergency and when perhaps they didn't need to. So I felt that overall we helped to keep people well, keep people at home productively, at work, and keep them out of hospital, out of emergency rooms, and sometimes not needing to see a doctor or a neurologist because we were able to manage some of these issues on their behalf. So this report has actually shown really impressive and important data after surveying 1,417 people who are participants of the Australian MS longitudinal study. And these participants are very representative of the population of people with MS in Australia. And those participants have, very generously given up their time to respond to this survey. And they have, overall, the information has come through that, in fact, MS nurses do make a huge difference to the health outcomes of people with MS. We make a difference to their overall quality of life. We make a difference to reducing their severity of symptoms across 13 different measures, so things like pain, spasticity, bladder and bowel function, a whole range of 13 factors in terms of symptoms were improved if people had access to MS nurses. We also found that their progression of disease was less significant if they had access to an MS nurse. We found that across many ranges of areas that we made a huge difference in terms of health outcomes. That was really starkly different. However, the big disparity we found was that only half of the participants surveyed actually utilised an MS nurse. And the reasons for that were quite interesting. We found that about a third of patients did not have access to an MS nurse. And of that third, about 18% did not even realise that there was such a thing as an MS nurse. So we found that awareness of an MS nurse was actually a really big issue. We also found that within that half of people who didn't utilise an MS nurse, that there was also a portion of about 13% felt that they didn't need to have access to an MS nurse. So I also would perhaps argue that perhaps there's also a lack of understanding of what our role encompasses. So I think overall that there's a massive need for us to, raise awareness, and that was certainly one of the major recommendations. In fact, the first recommendation of the report was to raise awareness of what our role is and the importance of the findings in terms of the stark difference in health outcomes for people who did have access and those who didn't have access. the second recommendation was to really support the existing MS nurse workforce. So at the moment we believe we have somewhere between 80 and 90 MS nurses to support the entire population of people with MS in Australia, and we know that there are 25,600 people with MS in the country, and there is not nearly enough MS nurses to support all of those people. And we know that there is a big disparity now. We can actually state that now with the findings of this report, that people who don't have access to an MS nurse do far worse overall. And I would also state that, in my belief, I think people who don't have input from that time of diagnosis, when a nurse can make a massive contribution to their understanding of the disease, their understanding of what is a relapse, when to act on that information, and when to be concerned enough to seek, medical advice, and when they don't need to worry, and when how we can allay their anxieties, and how we can, ensure that they're educated and informed. That is so crucial, that input at diagnosis. If they don't have that information, it is a major concern. While neurologists do a fantastic job, they don't always have the time to have that repeat contact with patients early on that MS nurses do. And I think that long-term contact that we have with people over that, this is a chronic lifelong disease. Unfortunately, we don't have a cure for this at this point. So the input that nurses make over that long period of time can be so important and so rewarding, and I feel we have an incredibly privileged role to play in the care of people over those many, many years. We also found in our report that we really need to expand the number of nurses. Obviously, 80 to 90 is not enough to cover the patients that we have in the country. We need to support and expand increase the capacity of our existing MS nurse workforce. And overall, we need to increase access to MS nurses for people, particularly in rural and regional areas. And I think we also need to do more to support neurologists working in isolation or in private settings, to ensure that they can say, look, I'd really love you to have access to an MS nurse. I can't do it on my own. Please call so-and-so. I think there needs to be additional support for that. So they were the key recommendations of this report, and I'd really encourage you all to take a look at the report. I think it's incredibly informative. It's available on the MS Australia website. If you Google MS Nurse Care Report, you will be able to find it really easily, and it's a really useful piece of information. I'm one of the co-authors. The research was conducted by the Menzies Institute in conjunction and funded by MS Australia. I guess just in summary, I'm absolutely passionate about ensuring equity of access to every Australian diagnosed with MS. In fact, everyone globally who is diagnosed with MS, I would like to ensure that they have access to an MS nurse. I believe the difference an MS nurse can make to the well-being and future health outcomes of people with MS is absolutely phenomenal. I think the role that MS nurses do is incredible, and the difference that we make is now absolutely evident from this MS Nurse Care report that's been conducted. I've certainly had a lot of interest since the presentation that I gave at ECTRIMS from nurses in other countries who would like to replicate the survey that we conducted, and will be trying to run that out in their countries so that they can raise awareness in their own countries. I hope too that there is stakeholder interest from federal and state funding bodies to ensure that we can have a better arrangement for more long-term funding for our nurses, many of whom are employed under soft funding arrangements or fixed-term funding arrangements, and cannot arrange for themselves to have ongoing certainty of funding arrangements within their own hospitals or centres. And it's really not fair, and it's certainly not fair for our patients, and it's not fair for our MS nurses. So we need equity of access for our people with MS, and we need some certainty of employment arrangements for our MS nurses. Thank you so much.